Hey guys, it's Danielle with Pure Root Wellness again, and today we're going to talk about just some basic vitamins, what they can do for you, how your body kind of processes them, and kind of get the basics on vitamins. So, vitamin A, fat soluble, stored in the fat and the liver, hence fat soluble. Really helps with preventing night blindness, enhancing immunity, repairs epithelial tissues like skin, mucous membranes, giving strong bones, teeth, kind of a lot of promotion from a bone and teeth aspect. Antioxidant, it's considered an antioxidant, which we'll kind of talk about, but it helps to really scavenge and neutralize free radicals. Promotes new cell growth, potentially helps lower cholesterol, and also has some benefits of slowing down the aging process. So all good things with vitamin A. And you can see in the upper right hand corner just kind of other healthy fruits, vegetables, maybe some dairies, oils that herbs that are considered higher in vitamin A. Right there, you can see adults maybe 5,000 IU to 1,500 micrograms a day of vitamin A is all you really need. Anything over 10,000 IU over a long period of time, you're potentially going to be looking at toxicity to the liver itself. So making sure, you'd really have to work hard at getting over 10,000 IU of vitamin A, but just being aware that it can cause some hepatic damage if you're constantly kind of pummeling the liver itself with a lot of vitamin A. And then during pregnancy, I didn't really know this actually when I was pregnant, but avoiding vitamin A during pregnancy can have some hindrance on, promoting birth defects. So taking beta carotene is actually a better option than actually taking vitamin A itself. Which is interesting. So, and the carotenoid compounds are actually related to vitamin A because they're considered a precursor basically for vitamin A. The beta carotene, the lycopene, again, they work to scavenge kind of all those free radicals out, neutralize them, hence giving the antioxidant properties. So, and truly to know the importance of vitamin A, the body really can't utilize protein without vitamin A. It's involved in regulating the growth and specialization of virtually all cells in the human body. So, kind of a take-home point of how important vitamin A really is for the diet, as far as either eating it through good, healthy vegetables, fruits, vegetables, like I'd seen in the picture, or supplementation. So getting into the B vitamins, lots of B vitamins. We'll start with B1, thiamine. It has a big role in energy production and cell function. Thiamine itself is absorbed in the small intestine, can be stored in the liver, doesn't really get stored for a long time. So this is why you kind of need a continuous supply from the diet of thiamine itself. Don't really need a lot throughout the day, 1.2 milligrams a day. But when you're looking at someone who is deficient in thiamine, typically patients will present with like weight loss, anorexia, confusion, some short-term memory issues, muscle weaknesses, and if it continues to progress, sometimes we see patients who develop what we call beriberi, which is characterized by like neuropathic issues, almost kind of like muscle wasting, neurologic wasting, sensory motor reflex function issues, and eventually, if it continues to develop, Wernicke's-Korsakoff is really, you're looking at someone who's profoundly encephalopathic. The brain just doesn't work the way it should. Profound peripheral neuropathy. This can actually lead to psychosis and potentially ultimately death. That's how serious sometimes a thiamine deficiency can kind of preclude. So, a very important type of B vitamin to continuously either get supplementation form or through the diet itself. And groups that are at risk for this deficiency, alcohol dependence is a huge risk group. Up to 80% of chronic alcoholics actually develop a thiamine deficiency one of two ways. The ethanol itself actually reduces the GI absorption of thiamine, and really the majority of the time when have someone who is a chronic alcoholic, the drinking surpasses the actual intake of good nutritional dietary food going in. So there's more drinking, less kind of eating. So you're not getting the thiamine from a nutritional standpoint, and you're depleting the thiamine from the GI absorption, just because the ethanol directly reduces that absorption. Diabetes, the research isn't clear if thiamine can actually aid in reducing some blood glucose levels. But we do kind of know, that there may be kind of a little bit of a correlation there. Could it help with diabetic neuropathy and things of that nature? A lot of evidence still needs to kind of happen in regards to that, but something to kind of look out for as far as groups that can be at risk for thiamine deficiency, being a diabetic is one. And then your geriatric population, obviously, again, you're looking at maybe a group that doesn't have as much nutritional intake as they once did, and the absorption, the gastrointestinal absorption is not completely what it used to be to absorb the thiamine itself. They're also looking into a possible role in the development of Alzheimer's disease and thiamine deficiency, simply because the deficiency itself can produce a lot of oxidative stress on the neurons, i.e. maybe even death of neurons, loss of memory, plaque formation. So all kind of markers of what Alzheimer's disease kind of encompasses. So really looking at maybe some more research in regards to the link between thiamine and development of Alzheimer's. B2, or riboflavin, again has a role in energy production, cell function, metabolizes fats, drugs, steroids. You don't need a lot of it per day as well. Most riboflavin, again, is absorbed in the small intestine. The body absorbs little riboflavin beyond 27 milligrams in a single dose. So really, more isn't going to be better. The reality is not more is going to be absorbed beyond that. And really what you do is just excrete it out in the urine. And groups that are at risk for this deficiency, vegetarian athletes or vegans are someone you really want to look out for. Exercise alone produces stress in the metabolic pathway that uses a lot of the riboflavin up. And especially if a vegetarian athlete or a vegan athlete is not getting in a lot of dairy product. Dairy product is high in riboflavin. And interestingly enough, they no longer sell, or at least a lot of companies don't sell milk in glass bottles anymore. Light actually inactivates riboflavin. The milk, when it's exposed to light, the riboflavin gets inactivated if it's stored in glass bottles. So kind of another just a little interesting nugget of knowledge that I was kind of finding out as I was looking all of this up, which is pretty cool. And then pregnancy, obviously baby takes, whether you're pregnant, breastfeeding, you have an increased risk of preeclampsia while you are pregnant if you do have a B2 deficiency, so something to be cognizant of. And, they were looking into like migraines and what riboflavin can do from a beneficial standpoint. They did do a study looking at participants who took about 400 milligrams a day, and they did have some reduction of their migraine attacks. Just because with migraines alone, there was thought that there maybe be some mitochondrial dysfunction thought to play a role in the development of migraines, and that riboflavin could kind of help to supplement that. But again, remember, after about 27 milligrams in a one-time dose, you're not going to get more bang for your buck, so you'd be dosing quite frequently throughout the day to get up to that 400 milligrams a day. Vitamin B3 or niacin. All tissues in the body convert niacin into its active form, which is NAD, nicotinamide adenine dinucleotide. And there's actually more than 400 enzymes in your body that require this NAD, which is pretty cool. Just something to really kind of think about, the NAD and the NADP, and I'm not going to go into kind of the whole biochemistry aspect of it, but it's really required to make usable energy for your body, which we call ADP. So this is the powerhouse. This is the ability to use the energy that you need to get through a workout, to get through a day, to get through, your shifts, what have you. The B3 or niacin is truly a need for the body. Adults need about 14 to 16 milligrams throughout the day. Tryptophan is a pretty good food source of niacin. It's equivalent about 1 milligram to 60 milligram ratio, which is pretty cool. But you can also get it from, a lot of plant-based foods such as nuts, legumes, grains. They also have like 2 to 5 milligrams of niacin per serving. So, if you're more plant-based and you don't want to do kind of the meat product aspect to get the B3 or niacin, you also have options there. Some side effects of the niacin, though, I know a lot of people complain of like the skin flushing that can come with niacin. You won't get this with nicotinamide. Simply because of the different chemical structure that nicotinamide is biochemically designed to be. But you can also get, the hypotensive effects, and this is really just because of the vasodilation that happens. Again, that's why the skin flushing happens, right? These blood vessels actually and vasodilate, getting kind of the flushing, the tension. The bigger the vessel, the lower the blood pressure will get. Again, this is more at like high doses. But with the nicotinamide supplementation, you may not get those same side effects, or at least not as severe if you were taking pure niacin. And then there are some studies that look at maybe lowering cholesterol with niacin itself. A lot more research needs to be done kind of in this area, but just some interesting points as far as from a health standpoint goes. B12 or cobalamin, they help with nerve function, myelinization, so getting a nice protective sheath on your nerves that helps the nerves fire well. It protects the nerves themselves, promotes good neurological functioning, red blood cell formation, and DNA synthesis. Very, very important B vitamin. B vitamin is actually bound to protein in the food, and it must be released in the saliva before it's absorbed, which I thought was super cool. I never realized that. So something, like I said, just when I'm investigating kind of all of these vitamins and looking at little like nuggets of knowledge, I thought that was pretty cool how it needs to be actually released in the saliva before the B12 can actually be absorbed. About 2.4 micrograms a day. So again, not a lot. We find this naturally in animal protein, fortified cereals, and nutritional yeast. For people who don't know what nutritional yeast is, there's a picture of it right above in kind of that little spoonish wooden spoon picture up there. It is actually deactivated yeast. It's a strain of Saccharomyces. It's cheesy, it's nutty flavor. You can add it to pretty much anything. Popcorns and food. Sometimes it makes, like if I'm making my vegan mac and cheese, it makes it nice and creamy and kind of thicker when I'm making vegan mac and cheese. But you can pretty much add it to anything. It doesn't have like a profound taste, but like I said, that cheesy kind of nutty flavor adds a lot of B12 if you're not consuming a lot of meat product. The bioavailability of B12 is 3 times higher with dairy product. So if you are incorporating dairy in your diet, it makes the bioavailability of B12 better if you take it with dairy. And 50% better bioavailability from supplements than food sources. So if you really wanted to go supplements, this is kind of the route where you're like, nope, rock out the supplements. You're going to get maybe a little more bang for your buck versus consumption from a natural food source. And really, when you're looking at like B12 deficiency, people who are B12 deficient, some hallmark signs are they get glossitis, which is like swelling of the tongue, fatigue, palpitations, pale skin, weight loss, numbness in your hands or feet. This is kind of a sign that maybe your B12 is starting to deplete. And, some other, high-risk patients, patients who have like GI surgeries, Roux-en-Y, what we call Roux-en-Y, kind of like a gastric bypass, patients who are on metformin, PPIs or proton pump inhibitors, people who have H. pylori infections lead to malabsorption of this vitamin, Crohn's, celiacs, vegetarian, vegans, obviously, for lack of animal protein, but all of these individuals fall within this kind of high risk of deficiency of B12. So vitamin C, also known as ascorbic acid, interestingly enough, humans cannot actually synthesize vitamin C endogenously. So this actually is an essential dietary component that needs to be ingested. Vitamin C is really required for making collagen, carnitine, neurotransmitters, protein metabolism, has some big roles, kind of throughout our function as a human being. Adults need about 75 to 90 milligrams a day. Anything over really a gram or 1,000 milligrams a day really don't get absorbed. You just pee it out. So if you think that you need to just pummel in like 2 grams of vitamin C in a day, you're wasting about a gram, alone. And it may be more beneficial to take them subsequently throughout the day versus a big hefty dose. People who smoke require about 35 milligrams per day more than non-smokers. So why do smokers actually need more vitamin C daily? Well, the research has shown that smokers actually have lower plasma and leukocytosis levels of vitamin C than non-smokers. Whether this is a result of the oxidative stress that smoking can cause, it's just something to know, to where if you are still smoking, which boo, you don't need to smoke. I know it's hard to nip, but it does nothing good for your body whatsoever. But if you are a smoker, getting that extra vitamin C a day is actually imperative, just because of the stress that you're putting on your body from the smoking alone. The vitamin C, you need some extra vitamin C to kind of supplement beyond that. And let's see, vitamin C. So what does it actually do for the body? It limits the formation of carcinogens, or the nitrosamines. So when I was talking about in my other podcast, nitrates, nitrites, and the preservative podcast, I kind of talk about the formation of these carcinogens. Vitamin C helps to limit these formations and modulates the immune system. And it's its antioxidant function. It attenuates oxidative damage that could lead to potential risks of cancer. That's where we get that big antioxidant property of vitamin C in itself. So what does the research say? Well, I know there's a lot of research on vitamin C and cancer. Let's talk about the vitamin C and cancer prevention. There's a randomized controlled trial showing that vitamin C in combination with other micronutrients really didn't affect cancer risk. There was a French RCT double-blind placebo-controlled. They had about 13,000 participants. They received the vitamin C, the vitamin E, the beta-carotene, the selenium, zinc, and versus placebo. And this study went for about 7.5 years and found that the antioxidant supplementation group had actually a lower total concern incidence, but only in the men, not in the women, which is kind of interesting. When you actually look at vitamin C and cancer treatment, we started looking at this back in the 70s, and they suggested that high-dose vitamin C had beneficial effects on the quality of life and survival time of terminal cancer patients. But an RCT out of Mayo Clinic really didn't support the same findings. So the only difference was the Mayo Clinic used, I believe, the oral vitamin C, not the IV form. And the reality is you can only saturate the plasma vitamin C to about 220 millimoles per liter. If you use IV, you can have plasma levels up to 26,000 millimoles per liter. So the concentration alone may have been the limiting factor between the two randomized controlled trials. But there are concentrations that you get up in the 20,000 somethings of vitamin C. There is evidence to suggest that it can be cytotoxic to tumor cells in vitro. But knowing that this may affect some chemotherapy agents upon infusion. Looking at vitamin C in the heart, vitamin C supplements, not from diet alone, actually may lower the risk of coronary artery disease. But other studies have kind of failed to show a benefit. A British study once showed that individuals with higher plasma vitamin C levels had a 42% lower risk of stroke than those with lower baseline. So there may be some, kind of benefit there from a cardiac standpoint. And then the big heavy hitter, everyone always says, you're coming down with something. Well, take more vitamin C, take more vitamin C. So vitamin C in the common cold. Prophylactic use of vitamin C did not significantly reduce the developing a cold in the general population. However, there was a trial. They looked at marathon runners, skiers, and soldiers who were actually exposed to extreme physical exercise and or cold environments. And the prophylactic use of vitamin C ranged from 250 milligrams a day to about a gram a day. that reduced their cold incidence by 50%. So this is, again, on like marathon runners, skiers, soldiers, stressor exposures, right? In the general population, the use of prophylactic vitamin C modestly reduced cold duration by about 8% in adults and 14% in children. So you're coming down with a cold. I don't think it'll hurt you to ingest more. There may be some, reduced duration from an adult to a child. But really when taken after the onset of cold symptoms, vitamin C really doesn't affect the cold duration or symptom severity, unfortunately. So vitamin D, it's actually a hormone, not so much a vitamin, more so a hormone, but we still call it the vitamin D. It's fat soluble from foods, and you can also get vitamin D from UV rays, sunlight. That triggers the vitamin D synthesis process. And when vitamin D is ingested, it has to actually go through a few conversions in the body, first in the liver and then in the kidney. So there's a few steps that need to kind of occur when you're, getting your vitamin D processed throughout your system. And vitamin D will promote good calcium absorption, which allows bones to really mineralize. The two forms of vitamin D, you're looking at D2, which is from the food sources, and D3, which is from the sun. You're looking at about 15 minutes, 3 times a week. And the darker the skin, the more challenging absorption, unfortunately, of the D3. Promotes healthy bones, teeth, thyroid function, normal blood clotting. It's a good, important factor of that. Disorders of the liver, kidney, gallbladder, and intestines actually interfere with vitamin D absorption. So patients who come in and have, a good majority of these, at least in my ICU, they have kind of some multi-organ dysfunction going on. It's not uncommon for their vitamin D levels to be profoundly low. You're looking at about 15 micrograms or 600 IU to about 20 micrograms or 800 IU of vitamin D needed daily. And real quick, let's just kind of touch base on vitamin D and health. So one of the big topics is always osteoporosis. As we get older, the bones break down. This happens faster than we can build the bones. Eventually, this can leading to bones that break easy. And research goes back and forth on whether supplementation can actually aid in preventing bone injury or fractures. One meta-analysis revealed that supplementation greater than 6 years, so for 6 years you're supplementating, reduced any fracture by 6% and a hip fracture by 16%. So, there is some research there. You got to stick with it, right? You can't just say, for 7 days I was good about my vitamin D and now my bones are stronger. We're looking at years spanned here where you need to kind of stay nose to the grind as far as supplementation goes. And if you want to know more about, I know I have a good picture of dairy products down there and milk and all the things. Go ahead and listen to my dairy podcast in regards to what milks and things can do for the body. This is kind of a sensitive subject, but in regards to milk consumption and the misconception that milk can help with bones and repletion and make strong bones is unfortunately just not there. It's not valid. So if you go ahead and look at the dairy podcast that I have, it'll talk way more in detail about that. But let's look at vitamin D and cancer. It might inhibit some carcinogenesis and slow tumor progression. Some of the research is showing supplementation does not affect cancer incidences, but vitamin D supplementation, more so maybe D3, sitting in the sun, can reduce cancer mortality rates by about 13%. And most of the benefit occurred with daily supplementation as well. So, and the research really, when we're talking about cancer, this is more breast, colorectal, lung, pancreatic, and prostate. In regards to the heart, vitamin D actually helps regulate what we call the RAS system, which is kind of in the kidney process, but can also help with vascular cell growth, which is very important. Deficiency is associated with arterial stiffening, hardening of the arteries themselves, LV hypertrophy or left ventricular hypertrophy. The part of the heart that pumps the hardest and squeezes the hardest is the left side base of the heart. and hyperlipidemia or high cholesterol. So vitamin D definitely plays a role in helping with the heart and the vasculature in general. Depression. People have looked at vitamin D in depression. Vitamin D is involved in a lot of brain processes. There's actually vitamin D receptors on the neurons themselves. There's no clinical trial that actually supports that vitamin D could prevent or treat depression itself. But the fact that the neurons themselves utilize vitamin D makes it seem like an important supplement to consider when you're looking at maybe a neurological dysfunction. So more research kind of in this area I think would be beneficial. Type 2 diabetes. Vitamin D does play a role in glucose metabolism. It tells the insulin to be released on the pancreatic beta cells and actually helps reduce resistance in the muscles and the liver. So basically the vitamin D is telling your body, go ahead and release more insulin. Don't be resistant to releasing that insulin. Another good important factor for people who are dealing with their type 2 diabetes. And then real quick, small blurb, but just because I just listened to another podcast kind of about vitamin D and COVID and how there's a strong correlation kind of when they were looking at the research with patients and kind of looking at vitamin D levels and some of the sickest COVID patients that were unfortunately terminally ill, had a high morbidity and mortality. But really finding the link that vitamin D promotes basically a healthy immune system. Vitamin D levels can actually be predictive of mortality from respiratory infections. Although this is not specific to SARS-CoV-19, I think it's important to know that, these meta-analyses are showing that vitamin D can prevent respiratory tract infections and aid in the severity of them. I think that's an important note and something for us to look forward to moving forward. I guess when we're kind of dealing with a lot of these pretty profound viral pneumonias that we're seeing. Vitamin E, it is a fat-soluble vitamin. This is the last vitamin we'll talk about. It's a group of compounds that have distinct antioxidant properties. Now, if you remember, an antioxidant will protect cells from the damaging effects of free radicals. These are unshared electrons that damage cells. And these electrons are real high energetic. They react with oxygen to form reactive oxygen species, or these ROSs. The body naturally forms ROSs when we eat junk. Basically, when we're exposed to free radicals from the environment, cigarettes, pollution, UV rays, all these things. And vitamin E is one that actually stops the production of ROS when fat undergoes oxidation. So it can be very, very helpful in regards to, the antioxidant properties that it can promote. Adults need about 15 milligrams a day. That is for the natural form. We're looking at about 33 IU for this synthetic form. And there's naturally occurring what we call alpha tocopherol, which is, a form of vitamin E. It's the most studied form of vitamin E. It has one stereoisomeric form. And the synthetic produced alpha tocopherol contains equal amounts of its 8 possible stereoisomers, basically. And the serum and tissues really only maintain about 4 of these stereoisomers. So if you're getting either the natural form or the synthetic form, there's kind of a difference in milligrams per se. But the alpha tocopherol is really what kind of the majority of the research has been done on that isomer for vitamin E. And really looking at the research with vitamin E and coronary artery disease, research is showing actually there wasn't a real significant benefit in reducing like cardiovascular events, stroke, heart attacks, cardiovascular deaths. But the studies were all done with like middle-aged elderly adults. None of the studies looked at like a younger population with no risk of cardiovascular disease, i.e. more preventative medicine versus like reactive medicine. So maybe something that is important in future research, entities to kind of look at. Cancer, it's difficult really to isolate just vitamin E to evaluate if it could protect people against cancer. looking at vitamin E when you already have cancer, the research did show that people who had like bladder cancer took vitamin E for 10 years had a lower risk of death from their cancer. But there is some research to say that supplementing vitamin E may increase the risk of developing prostate cancer. So I think you really have to be careful with this. You need to be talking to your healthcare provider, your naturopathic physician, people who kind of know the right balance and the appropriate amount to not put yourself at risk for further cancers if you are supplementing with vitamin E. And then a lot of research with eyes, like macular degeneration, cataracts. Again, this is kind of a disease process that's thought to be a cumulative effect of oxidative stress playing a role in the disease process development. The evidence can really go either way. There was some research showing that vitamin E plus or minus beta carotene, vitamin C, zinc, and copper could reduce the progression of macular degeneration and improve lens clarity with cataracts. But again, the evidence was kind of stalemate a little bit, kind of equivocal when it comes to that information. So, again, a lot more research that needs to kind of come about. But I think, having some vitamin E supplementation, at least in a healthy nutritional standpoint, unless you're going crazy and having excess, I don't think the damage is going to be profound if you're staying pretty consistent with consumption. So that is all of the vitamins we'll talk about this go around. I hope this was helpful. You guys had some good information that you can use and utilize for your own health and well-being. And I hope everyone is doing well and be well. I'll see you again soon.